I would like to invite Dr. Amey, Division of Cancer Care, Hospital Cancer Registries and Survival Studies, Center for Cancer Epidemiology, ACTRAC, Tata Memorial Center, Mumbai, India. The title of his talk is Role of Education and Income on Disparities of Time to Treatment Initiation and Its Impact on Cervical Cancer Survival, a retrospective study in Tata Memorial Hospital, Mumbai.
Good evening, everyone. My today's presentation is an article of the topic is role of education and income on disparities of time to treatment initiation and its impact on cervical cancer survival. It's a retrospective study at TMH Mumbai. I presently work as officer in charge of Division of Cancer Care, Hospital Cancer Registries and Survival Studies, CC ACTRAC, Tata Memorial Center. The co-authors of this study were Dr. Sivaranjani, Ms. Sandhya Cheulkar, Dr. Amita Maheshwari, Dr. Umesh Mohan Shetty, and Dr. Rajesh Dikshit. Yeah. To begin with, early detection, diagnosis, and treatment can control the progression of cervical cancer. And the main factors that influence the survival rates of cervical cancer are stage at diagnosis, access to diagnostic and treatment facilities, and availing of the main treatment modalities. There are several studies which have reported poor prognosis for cervical cancer patient when the treatment is delayed, and the longer time to treatment initiation has basically two components, that is the patient delay and the health system delay. Now, what is patient delay? The patient delay is the time from the patient's first awareness of symptoms to the first consultation with a health professional, while the health system delay is the time from the patient's first consultation through the final histological diagnosis to the treatment. Now, the majority of cervical cancer patients present at an advanced stage of disease in hospital or healthcare facilities due to lack of awareness, and the lower socioeconomic status is associated with inferior cancer survival in high-income countries, and there are several studies which can confirm this fact, but whether this phenomenon applies to lower and middle-income countries is not well described, and therefore this article is important. This study assessed the role of the education and income and disparities of time to treatment initiation, and the results of this study will help the policymakers and healthcare providers to improve hospital policies and interventions so that it would reduce the treatment delay and improve the survival among the cervical cancer patients. Now, the present study is a retrospective hospital-based study. The duration of the study was between 2014 and 2016. The sample size was almost 2,000 patients, that is 1979 patients, and all the newly treated cervical cancer patients registered between 2014 and 16 were included in the survival analysis. Now, the International Classification of Diseases, that is ICD coding, was used for the classification of site and histology of cervical cancer, while the FIGO staging was used for the staging of the cancer. The data was then validated and filtered through MS Excel and analyzed by Stata, and the education was categorized into three groups, namely illiterate, primary, and secondary education or higher. The family income was categorized into three tertiles, that is from low to high income, by arranging the income of all the patients from low to high and then dividing it equally into three groups. Now, time to treatment initiation, that is TTI, was calculated from the date of registration to the date of first treatment initiation. The TTI was divided into two categories, that is between 0 to 30 days and greater than 30 days. The data analysis was done by using Stata. Chi-square test was used to find the association between age, stage, and type of treatment and the socioeconomic status. The Kruskal-Wallis test was used to demonstrate difference between the TTI and socioeconomic status. Then the Kaplan-Meier method was used for the overall 3-year survival, and the survival was compared among education, income, and TTI categories using log-rank tests. Then multivariable analysis was used by doing Cox proportional hazard regression to estimate the risk of overall mortality, and the prediction of mortality by each variable in various, the first, third, and second model was interpreted as an adjusted hazard ratio with a 95% confidence interval. Now, to show you the results, uh, the overall participants were approximately, the overall participants 1979 between 2014 and 16, and a total of approximately, the total of 400 patients, participants died during the 3-year follow-up period. Therefore, greater than 3-year follow-up information was available for 70% of the participants, while for 595 patients, that is 30% of the patients, uh, less than 3-year follow-up information was available. The characteristics of the study participants are shown in this table. The education levels among cervical cancer patients were 15.21%, 39.46%, and almost 45% for illiterate, primary, and secondary education or higher. A significant decreasing trend in the mean age of study participants was observed as the education status shifted from illiterate to higher education. The highly educated cervical cancer patients had a greater proportion of localized extent of disease, that is stage 1 compared with illiterates. And compared with the illiterates, those who had a secondary and higher education were initiated on treatment earlier, that is their TTI was less, that is 35 versus 28 days. And a clear stepwise decreasing trend in TTI was noted as we move from lower to higher income category, that is 35 versus 27 days, and it was found to be statistically significant. Now, the figures 1 and 2 show the 3-year survival of cervical cancer patients. The 3-year survival of cervical cancer patients increased with an increase in the education status, that is from 75.54% in illiterates to 77.3% and 85.1% in primary and those who had secondary education or higher. And this was found to be statistically significant. Similar findings were observed with income level also, that is as the income level rises, the survival increases. Now, in this table, the multivariable analysis of the association of education, income, TTI, and survival using the various models are summarized in this table. The crude model for education level showed a 37% lower hazard ratio, that is 0.63, for participants who had secondary education and above compared to illiterates, and this association was statistically significant. After adjusting for stage, the hazard ratio for higher education decreased from 37 to 25% in the second model, and further decreased to 0.11% in the third model, but was found to be insignificant. The crude model for the income category also reported a 22% lower hazard ratio for the participants who belong to tertile 3, that is high income status, and this association was found to be statistically significant. And after adjusting for stage, the hazard ratio for the higher income category declined from 22% to 18% in the second model, but was found to be insignificant. Participants who were initiated on treatment within 30 days had a 10% lower hazard ratio compared to those initiated after 30 days in the crude model. However, in the second model, the adjusted hazard ratio was higher for those who had delayed treatment because in case of people who are detected with advanced stage, the treatment may have been initiated earlier as compared to those who are detected at an earlier stage. This was a kind of a peculiar finding. Now, in discussion, statistically a significant difference was observed with respect to the prevalence of cancer patients with stage 1 at diagnosis between illiterate individuals and those who had secondary or higher education status, and a greater proportion of stage, stage 1 cancer patients were found at presentation among highly educated patients compared to illiterate ones. And this difference is because the good health literacy among educated people helped them to avail the health services at an earlier stage. A similar study by Matthew et al. Comprising 481 cervical cancer patients from 2012 to 14 reported similar findings, and even the modalities of treatment, that is those who are more educated or of higher income level, availed more treatment modalities like surgery, radiotherapy, chemotherapy as compared to the people with a lower socio-economic status. Also, the median number of days from registration to treatment initiation was lower among the higher education categories, that is secondary education or higher, as compared to illiterates, and this association was significant. This may be attributed to the long waiting lists for initiating the treatment, the non-compliance to schedule appointment, and simply lack of awareness of early interventions, lack of financial and social support, especially in the lower socioeconomic category. A similar study was done in Brazil showing similar findings. The 3-year survival rates for those with no formal education, primary education, and secondary education were 78%, 79%, 86%. And a clear stepwise increasing gradient was observed in 3-year survival across the education and income status among cervical cancer patients. And there was a similar study in Tata Memorial Center from the period of 2006 to 8, which also showed similar findings. Also, in another randomized controlled trial by Tulsidaran et al., 165 subjects were there, and it reported a 38 and 65% 3-year survival among illiterates and literates respectively. Now, this inferior survival as compared to our study was because it was done at a much, this study was done in 2006 to 2008 as compared to our study, which has been done in 2014 to 16, where the health facilities are slightly better as compared to 2007 and 8. And the accrued mortality rate was lower for participants with secondary education and above as compared to illiterates. And this effect inclined after adjusting for age, tumor staging, treatment, and cumulative TTI, but these findings were insignificant. In a similar study done in Taiwan, the findings were similar for the higher hazard for patients initiated after 30 days, but after adjusting for stage, the hazard reversed, indicating that the advanced stage were initiated, the patients with advanced stage were initiated within 30 days. Several other studies from across the globe have also independently proven that lower education, income, and delayed treatment results in inferior survival. To conclude, our study is unique because it explains the pathway of lower education leading to delayed health-seeking behavior and in turn resulting in inferior survival. Socioeconomic factors are linked to survival and play an important role in the probabilities of being early diagnosed, to get access or for completion of treatment and follow-up, and survival is mediated by all these factors. The study is strengthened by the large sample size and the inclusion of information regarding stage and treatment modalities which have an impact on survival. Cervical cancer patients who are illiterate and belonging to low income category are presenting in an advanced stage of disease, and the higher socioeconomic patients are initiated on treatment earlier compared to the lower socioeconomic ones, and an inferior survival is observed in cervical cancer patients with lower education, income, and in those who have received delayed treatment. And finally, health education and screening campaigns should be targeted at the lower socioeconomic status population, which will improve the treatment seeking behavior and hence the survival of the cancer patients. These are the references. Thank you so much for this opportunity. Thank you.